Hi, this is Dr. Kat Vlies again from Central New Mexico Community College, and this is video E. As we continue with the digestive system, we're going to focus on just the esophagus in this particular video. The esophagus is a pretty straight tube that starts at the end of the pharynx with an upper esophageal sphincter muscle all the way down to where it enters into the stomach, where we have the lower esophageal sphincter, which has several synonyms. It might be referred to as the cardiac sphincter, which is typically the term I tend to use, or the gastroesophageal sphincter. Where the esophagus penetrates the diaphragm, we see an opening called the esophageal hiatus. The vagus nerve passes through there as well. The stomach could potentially push up through that opening. So here near the bottom of the screen, I hope you guys can still see where I'm pointing, the stomach could potentially push through that opening in the diaphragm, creating a hernia in that particular location. The sphincter, and that's what we refer to as a hiatus hernia, by the way. So the function of the sphincter muscles is to, the upper esophageal sphincter muscle is going to help with the movement of the food from the pharynx area down into the esophagus by means of peristalsis, while the lower esophageal sphincter is going to control when food can enter from the esophagus into the stomach. Clearly, this is also going to be the muscle area that is going to prevent the stomach contents to reflux back up into the esophagus to create heartburn and reflux problems. These sphincter areas, I really should call them, are not true anatomical sphincters, by the way. They're not muscle areas that are really thickened, as we will see in in the stomach at the distal end, where we have a nice thickened round sphincter muscle. That is not the case here for these esophageal sphincter muscles. Final comment to make about the esophagus is that it's lined with stratified squamous epithelial tissue, but the second that we see the transition between the esophagus and the stomach, we see a very abrupt transition to simple columnar epithelial tissue. So here we see a nice image of the esophagus. Right here we see the lumen, which is lined with our stratified squamous epithelial tissue, along with some connective tissue referred to as our mucosa. Deeper to that, we have our submucosa, which contains quite a few glands, esophageal glands, as you can see there, that secrete mucus. And then the thickest layer usually is the muscularis externa, which contains both skeletal and smooth muscle, depending on where we are along the length of the esophagus. Closer to the pharynx, we're going to see much more skeletal muscle tissue, while as we descend down towards the stomach, we tend to see more smooth muscle. Remember that the esophagus is not located in the abdominal pelvic cavity, certainly not in the peritoneal cavity, so it's only going to be covered with adventitia. Both the pharynx and the esophagus are involved in the process of swallowing. A fancy term of referring to swallowing is deglutition. It involves a lot of muscles. Swallowing is a very complicated process, and of course we're not going to list all of these muscles, but we do need to be aware of the fact that there are two distinct phases: the buccal phase and then the pharyngeal esophageal phase. The big difference between the buccal and the pharyngeal esophageal phase is that the first phase, the buccal phase, is completely voluntary. So we consciously make the decision to start the process of swallowing. We might not always think about it exactly like that, but we can actually control, if we really force ourselves to think about it, whether we're going to swallow our food or not. And so during the buccal phase, where the bolus that we formed with the help of our tongue is going to be pushed into that oropharynx. Once the bolus hits that oropharynx, the next phase that kicks in is completely involuntary. And while we earlier talked about salivatory centers in the brainstem, this time we're dealing with the swallowing centers or the deglutition centers located in the brainstem, with a different cranial nerve involved. This time the vagus nerve is going to be involved in regulating the process of deglutition. Now, what needs to happen in order for the food to make it down all the way into the esophagus is, of course, for the food to not go up into the nasopharynx. So we're going to see that the soft palate, along with that little flap we call the uvula, needs to close off the nasopharynx. The tongue is going to block off the mouth to where the anterior portion of your mouth is blocked off and the food is not going to fly out of your mouth, essentially. And then, of course, the obvious thing, the epiglottis is going to cover the trachea. Once the food enters the esophagus, peristalsis kicks in. So, once again, we see that the centers involved in deglutition are located in the brainstem, just like the salivatory centers, just like our cardiac centers, just like our vasomotor center were located, and even respiratory centers were located in the brainstem. That's where all of that involuntary motor control occurs. And from this point forward, the nerves, or the nerve pair, I should say, that is going to play the most crucial role in digestion is the vagus nerve, or the pair of vagus nerves. So this wraps up our discussion of the esophagus. We looked at its gross anatomy, its histology, and we discussed regulation of deglutition.